Everyone takes ibuprofen. Everyone. Mostly every single person that I know has taken ibuprofen in many times of their lives. Probably you, me, whoever. We know everyone is taking it, but do you know what it does in our body? How does it act? What are the risks? What are the benefits? What are all those myths in society and social media that people are talking all the time about ibuprofen? Let's go deeper and start talking about this medication that is widely used all over the world, so we can know how to use it in a safe way, when, what's the dose, and how to avoid all the complications that we might get. Which are the things that people say about ibuprofen? Is it true that it can cause kidney damage? Well, it can. It can only be done if you consume it for a very long period of time in a very high dose. But if you take it just once, it probably is not going to do anything at all. People think that sometimes that it's harmless because you can take it over the counter. But the fact that something is over the counter, or by the fact that something is natural, which is not the case in here, it doesn't mean that it's completely safe and then nothing is going to happen. People think that also that ibuprofen is safe for everyone. Nope. There are people that cannot consume ibuprofen. For example, a woman, when she's pregnant, they cannot consume ibuprofen because they can create a problem in the baby's heart. So not everyone can consume ibuprofen. That's why we need to be aware that not everyone in every single moment of their lives they can consume it. People sometimes they think that ibuprofen and acetaminophen that they're the same thing. Nope. One is used more for inflammation in a part of pain, and acetaminophen, it's just for pain. And I'm going to tell you in a minute how they act, how they work, where they work, and every single process that goes through in your body, so you can know specifically every time that you take it or that you're taking it, how it has been acting in your body. People think also that we need to take it with an empty stomach, and please, no, don't. Some of the complications that we may get from ibuprofen, I'm going to be explaining it in a moment, is that it can cause bleeding or it can cause gastritis in one specific part of the stomach. And some people think that when you're taking ibuprofen because you have chronic pain, that maybe you have any sort of dependence or addiction to ibuprofen. And nope, there is no mechanism in which ibuprofen can cause any type of addiction. What is ibuprofen? Well, it's a medication that is part of a group of anti-inflammatory medications called non-steroid anti-inflammatories. Why non-steroid? Because steroids, such as all the corticoids, those are the group which are steroids. They come from an ester, which is cholesterol. But they come from an ester. It's completely different. These are non-steroid, such as ibuprofen, such as naproxen, such as diclofenac. There are a bunch of different anti-inflammatories which are part of this group. If you can check on this image, I'm going to show you. It says on the upper part, it says arachidonic acid pathway. So you have tissue injury. When you have the injury, you release from the cell membrane something called arachidonic acid. It's a fatty acid, and it's the same composition as any of the omega-6 that we have in our body. We have omega-6 arachidonic acid in our body. So our cell membranes, they release this specific type of omega-6, and then it goes to two different pathways. One of them, it's if you can see on the left side, that it says COX-1 and COX-2, the cyclooxygenase pathway, and everything goes down to where it says prostaglandins. So when we block that, all that cascade, all that path of inflammation is going to be blocked, lowered, so we don't get all the effects from inflammation. Which are the effects of inflammation? You can get the area red, swollen, with pain, and all the different characteristics that make up inflammation. So when we block this is the effect that it gets. It's blocking both COX-1 and COX-2, because there are medications that block specifically COX-2, but this one blocks both. That's why it's strengthened. That's why some of the side effects also are completely different from the other ones. But what are the dangers? What are the dangers from taking ibuprofen? Is it safe for everyone, or should I be concerned of something at all? If you go and check the stomach, the lower part of the stomach, it's called the body of the stomach. In that area, these kind of medications can cause bleeding, can cause gastritis or ulcers, specifically in the body of the stomach. So gastrointestinal bleeding, ulcers, gastritis, anything is the number one side effect from ibuprofen or any of this group of medications. They could also, again, cause kidney damage when taking in a very high dose for a large period of time. They could also raise cardiovascular risk. When you block these two, COX-1 and COX-2, especially when COX-2 is blocked for a large period of time, cardiovascular risk raises. That's why when people take these medications, they can only get them, the COX-2, they can only take them for around 8 to 10 days. More, it's related with heart attacks. But this one, the risk is lower. But again, we need to be aware that this could happen. Some people can get allergic reactions to ibuprofen. I've seen a lot of people, even they can exacerbate or make worse any asthmatic reaction. That this can occur at any moment of your life. You're not born with this. You can develop this over time. Over time, you can develop this. And please note that whenever you see someone with this, you need to go to the ED because these allergic reactions, most of the time, they are very intense. Ibuprofen can also have interactions with some medications, such as blood thinners, and some kinds of antidepressants can have interactions in which the medication can stay more time in our bloodstream, or it can help the medication to be for less time in our bloodstream, interacting or lowering or affecting the action of that other medication. Again, I want you to be aware of the risks during pregnancy. During pregnancy, the mother takes ibuprofen, the baby is going to have an alteration on the circulation of the heart, is going to have a closure of one of the ducts that the baby has in the heart, and this is going to be very detrimental for the baby's health, and the baby can die. So please note, if you have or if you see a pregnant woman that has a headache without noticing what she's getting into her mouth, please stop and let her be aware that this could happen. And also, you can get an overdose. The overdose of ibuprofen, it's related with nausea, vomiting, stomach pain, drowsiness, and different things. And so please, if someone gets an overdose, please go to the ED and get medical attention. So just to make a little final recap, what is ibuprofen? It's an anti-inflammatory medication. It's good for every single sort of inflammation. Is it going to help me with pain? Yeah, because pain is one of the manifestations of inflammation, but by itself, ibuprofen is not an analgesic medication. It's for inflammation, and controlling inflammation might lower pain by itself. Please be aware that doses around 200 and 400 milligrams are tolerable for mostly everyone. For adults, if it's for a baby, please go and get advice from your pediatrician. And please remember that this is something that we should be taking maybe just once or maybe for a couple days, and that's it. We should not be taking ibuprofen on a regular basis because I just jogged and I'm going to take ibuprofen to prevent from having pain tomorrow. Or I played soccer and I had some contact, so I'm going to take ibuprofen, and then taking ibuprofen every single day, or because I get a migraine every single day, go and see a physician to see why you have migraines. But taking ibuprofen or any other of these medications every single day could be very detrimental for your health. This is the kind of advice that I wanted to give you. And I know it could be very simple for some of you, but this is the only way in which we can create awareness and consciousness from those little details, from those little decisions that we're making every single day. And this is the purpose of this channel, to remember you are in charge of your own health. And you're in charge when you have the tools, when you have the knowledge. And this piece of tool, I think that it's very important. So remember, before you leave, to hit the like button. Please remember also to subscribe to the channel and to click the bell. So every time that we make new videos, you're going to be the first one to be notified. Thank you. Until next time. So please, this is the kind of advice that I would want,